I was reading an article a few months ago, and the author said, without hyperbole, that the advent of AI will be more significant to human beings than the discovery of fire. This is fake. I can't light the building on fire. But it's quite the claim. Not only because of the ways that we've built upon that initial spark that created a single flame several 100,000 years ago. I'm going to put this down over here. But also because of how new artificial intelligence is across the landscape of human ideas. It's a pretty spectacular technology, and I'm beyond excited to see what's going to happen. Now, I have no idea whether AI will be more significant to human beings than the discovery of fire. But if you think about it, the claim really isn't that outlandish, especially when you consider all the ways in which AI is being used, especially in healthcare. If you're over a certain age, pick up any newspaper. If, like me, you're under a certain age, type the web address of any major newspaper into your browser. It seems like every week, I was just talking to someone during the break, it seems like every week, and lately almost every day, there is some headline that celebrates yet another breakthrough. You can't even go to school for AI because you're going to be outpaced by the advancement in technology immediately, almost overnight. ChatGPT changes every 2 weeks. AI is helping providers diagnose a range of conditions with alarming, though unsurprising accuracy. Some studies have shown that AI has proved better than radiologists at identifying cancers of the breast, the lung, or of the skin. It can detect heart disease with greater accuracy than cardiologists. It can identify certain eye conditions better than ophthalmologists. Pretty surreal. It can diagnose Alzheimer's disease, acute appendicitis. It can do unbelievable things like pinpoint minute, difficult to see bone fractures. It's expected to disrupt the pharmaceutical industry as well, because AI has been used to not only determine ideal medication dosages, but also create new treatment pathways for patients. It creates new molecular targets for medications altogether. And God forbid you find yourself in an emergency room, but there is a decent chance that you will be triaged in that emergency room by some kind of AI provider. Not far-fetched. It's not even on the horizon. I was talking with someone else earlier as well about this. It's not even on the horizon of the near future. To borrow one of my favorite redundancies, this is the current present. These breakthroughs already happened. You can open up your phones, pull out your phone here, and you can search and say, hey, what's going on in the world with AI? And you're going to find something different. We are in the dawn of a healthcare transformation that is yet to come when it comes to AI. And we're still in the very early days of fire. But it's interesting. Research has shown that patients are a bit cautious when it comes to trusting AI in healthcare. For example, professors at Boston University and New York University conducted a study where they asked patients to choose who they wanted as their provider based on performance. Now think about this, put yourself in their shoes. In the first set, they were given 2 human doctors, and invariably the participants opted for the doctor with a higher performance rating. That makes sense. But then the researchers gave the same group a choice between a human doctor and an AI provider. Even though the AI provider was shown to have higher performance scores, the participants more often opted to have a human doctor as their caregiver. The researchers concluded that it wasn't accuracy that made patients apprehensive. It was the perception that they, the patient, are unique individuals. AI providers were perceived as machines, incapable of understanding nuance, emotion, and the tremendous complexity that comes with the territory of personalized medical care. Now, let's face it, AI providers are also new. They're a bit of a novelty. And it's perfectly reasonable to assume that as AI systems improve, as they continue to be leveraged in healthcare settings, patients will become more accustomed to them and may actually prefer having an AI provider review test results or images just to be sure the human doctor didn't make a mistake. Think about it. If you went to the doctor and received an X-ray or an MRI or a CAT scan, and the doctor said that it was inconclusive, but offered you the option of having an AI provider look at it for no additional cost, just to be sure that it catches anything. I can't speak for everyone in this room, but I know that I would certainly take the AI-led second opinion. And vice versa. If the scan is first reviewed by an AI provider and it finds something concerning, I'd still want that scan reviewed for a second opinion by a human provider. It's really a both-and scenario at the moment. The acceptance just isn't there yet. There's probably a lot of pent-up frustration. That distinction of wanting a human is probably a bit of shared PTSD from calling customer service hotlines all those years ago and getting automated bots that never understood anything that you said. That's a very early form of AI, in fact. But I do think it's safe to assume that in the not-so-distant future, most people will have, at the very least, AI-influenced care. It's already happening. So what does that mean for providers? What does it mean for the people who are left, the folks in this room? How are you all going to get jobs and keep your jobs? Well, if I may, let me offer a suggestion. You see, I study the human side of work. I wrote a book about it. How do we actually transform human organizations? In the business world, transformation is just a nice way of saying cost cutting. Companies undergoing periods of transformation want you to think that they're actually sitting around the drawing board, reinventing the way in which they work. But what they're really doing is often laying people off to cut costs. And when your costs are down, but sales remain the same in the short term, your stock price goes up. So the word transformation, unfortunately, in the business world is often a bit of a parlor trick. Same with healthcare. You want to talk about exponential growth in healthcare? It's going to happen whether we like it or not through the adoption of AI. And healthcare organizations are going to transform themselves in ways that provide quality patient care, but also in ways that help cut costs. And you heard it here first, but replacing salaried human beings with AI systems to save money in healthcare, it's going to happen. It's already happening. But I look at transformation as it is intended. How do we dramatically change organizations or institutions or ways of thinking in positive ways? So here we ask, how do we transform healthcare in positive ways in the age of AI? Well, can we go back to this for a second? The artificial candle. Do you remember when I said at the start of this talk that somebody claimed the advent of AI will be more significant to humanity than the discovery of fire? Well, I would argue that, like artificial intelligence, what I'm about to propose to transform healthcare in positive ways in the age of AI has been more significant to humanity than fire. You see, we have this ancient, if not eternal skill ingrained within us as human beings that allows us to create wondrous technology like artificial intelligence, like artificial candles, that allows us to invent machines, to design treatment plans, to innovate and collaboratively build solutions to the problems that we face as a species. And are you ready for what this skill is called? The secret superpower that we all have? Well, it's called AI. I kid you not, only it's not artificial intelligence. It's a different kind of AI called active inquiry. Active inquiry is a communication technique that's used to engage people in deep reflection and dialogue. The way it works is by using open-ended, thought-provoking questions that don't have simple yes or no answers, but that instead encourage people to think critically and explore their thoughts and feelings on a deeper level. For example, if I asked you, does your head hurt? Then chances are you would respond with a yes or no answer. That's a closed-ended question. But what if instead I asked, how does your head feel? That's an open-ended question. It necessitates a more elaborate response. It may sound like silly semantics, but in the context of healthcare, active inquiry can be used by providers to better understand a patient's experience, to empathize with their emotional state, and to tailor treatments to the unique needs of each individual. Remember, that's what people said they wanted. That's AI, active inquiry. It's a process that values the nuances of human interaction. It acknowledges that each patient's story is unique, and that understanding comes not just from clinical observations, but from listening and engaging in meaningful conversation. This isn't a difficult thing to adopt either. It's free. I'm not selling active inquiry on a website for $29.99 or billing a hospital administrator a licensing fee. We all have the capacity. We all own the skill. We just have to exercise the muscles a little bit. And frankly, providers will have to exercise those muscles if they want to be successful and have a career. It's been forecasted that up to 80% of what healthcare providers do in hospitals could be replaced by artificial intelligence soon. Those active inquiry muscles may be all that providers have left. If you don't believe me, just a few months ago, Google announced that its artificial intelligence system fared better than human providers on patient surveys in terms of bedside manner. Active inquiry matters. It makes a noticeable difference, and it's how you as healthcare professionals can stay ahead of the curve. If you want to get down to brass tacks, we can. I'm an MBA. In one study, 100 managers were broken into two groups to solve strategic challenges. The first group was told to dive right in. The second group had to spend 10 minutes sharing and asking one another about embarrassing stories before starting to encourage emotional bonding. The group that bonded emotionally was more successful by a rate of 26%. The Wall Street Journal shared another study that showed employees who underwent active inquiry type empathy training generated up to 50% more net income than their peers. This backs the Carnegie Mellon study, which concluded that approximately 85% of financial success is related to skills in human engineering, active inquiry skills. But best of all, and perhaps most importantly, active inquiry creates positive patient outcomes. There was a study conducted by the National Institute of Health, which found that patients were more likely to have a positive outcome when admitted to an emergency room. In other words, when they were treated by a doctor they did not know, if they felt the doctor understood them on an emotional level. Personalized care through an emotional connection, a human bond, and dialogue. That's AI. Well, that's the original AI. And while I can only imagine or try to predict the tremendous impact the new AI will have on healthcare, and trust me, I am so excited to see what lies ahead. You could make the case that the original AI, active inquiry, not only led to the discovery of fire and fake fire, but it was most certainly just deployed as we figured out all the different ways to harness and build upon the discovery of fire. A new technology that was destined to change the world. Thank you.